Hello, gentlemen. Recovering from a stroke is a challenging journey, and often, certain aspects of recovery are discussed less openly, yet they profoundly impact your confidence and quality of life. Issues like erectile dysfunction or premature ejaculation can unfortunately arise after a stroke, leaving many feeling isolated and disheartened. Today, we're going to talk about a powerful, yet often overlooked, secret weapon that can help you regain control and confidence: Kegel exercises for men. We'll follow Michel, a gentleman from New York who faced these very challenges, as he navigates his path to recovery. His journey will illustrate how these simple exercises can make a significant difference. Let's begin by understanding what Kegel muscles are and why they are so crucial, especially for men recovering from a stroke. The Kegel muscles, also known as the pubococcygeus muscles, are a group of pelvic floor muscles that stretch from your pubic bone to your tailbone. Think of them as a hammock supporting your internal organs, your bladder, bowels, and for men, they play a vital role in sexual function. These muscles are essential for controlling the flow of urine and, importantly for our discussion today, the flow of semen. After a stroke, nerve damage or general weakness can impair the function of these muscles, leading to issues like urinary incontinence, or the aforementioned sexual health challenges. When these muscles are strong, they help you in several key ways. Firstly, they assist in maintaining an erection for longer by helping to keep blood within the penis, which is often a significant concern for stroke survivors. Secondly, they provide better control over ejaculation, potentially addressing premature ejaculation. Thirdly, strengthening these muscles can enhance sensation during intimacy and intensify orgasms. Michel initially felt a profound sense of loss and embarrassment after his stroke, especially regarding his sexual health. He was skeptical that some exercises could help, but his doctor gently encouraged him to learn more, emphasizing the connection between pelvic floor strength and his overall well-being. This was his first step towards understanding this vital part of his body. Before you can strengthen your Kegel muscles, you need to know how to locate them correctly. This is a crucial first step, as many people mistakenly engage their abdominal, thigh, or buttock muscles instead. The easiest and most common way to identify your Kegel muscles is when you are urinating. While in midstream, try to stop the flow of urine. The muscles you use to do this are your Kegel muscles. You should feel a distinct lift and squeeze in your pelvic area. However, it's very important to note, only do this once or twice to identify the muscles, and do not make it a regular exercise practice. Regularly stopping urine midstream can lead to incomplete bladder emptying, which may increase your risk of urinary tract infections. Another method is to imagine you are trying to stop yourself from passing gas. The muscles you clench to do this are also your Kegels. You should feel a tightening around your anus and a slight lift in your perineum, the area between your scrotum and anus. When you identify them, try to isolate them. The key is to feel only those muscles contracting, without tensing your buttocks, thighs, or abdominal muscles. Michel admits he struggled with this initially. He tried the stopping urine method and found it confusing, often tensing his stomach. It took him a few tries, practicing in front of a mirror to ensure other muscles weren't moving, until he finally felt that unique, isolated lift. This aha moment was the real beginning of his Kegel journey. Now that you can identify your Kegel muscles, let's dive into the exercises themselves. Consistency is paramount, and integrating these into your daily routine is key. We'll start with the basic exercise, then move to a more advanced variation, and finally discuss how to seamlessly incorporate them into your life. 1. The basic exercise: slow contractions. This exercise focuses on building endurance and strength in your pelvic floor. Starting position: lie on your back with your knees bent and feet flat on the floor, hip width apart. You can also perform this sitting upright or even standing, but lying down can make it easier to isolate the muscles initially. The movement: slowly tighten your Kegel muscles, as if you're trying to stop the flow of urine or hold back gas. Hold this contraction for 5 seconds. Focus on keeping your other muscles, your abdomen, buttocks, and thighs, relaxed. Relax. Slowly release the contraction and relax your Kegel muscles for 5 seconds. It's crucial to fully relax between contractions to prevent muscle fatigue. Repetitions and sets. That's 1 repetition. Aim for 10 to 15 repetitions per set. Complete 3 sets each day. Progression. As your strength improves, you can gradually increase the hold time to 8 to 10 seconds. Always matching the relaxation time with the contraction time. 2. The advanced exercise. Quick flicks, fast contractions. This variation targets the fast-twitch muscle fibers, which are important for quick responses, such as preventing leakage or controlling ejaculation in critical moments. The movement. Rapidly contract your Kegel muscles, then immediately relax them. Think of it as a quick squeeze and release. Repetitions and sets. Perform 20 quick contractions. Complete 3 sets each day, just like the slow contractions. 3. Integrating Kegel exercises into daily life. The beauty of Kegel exercises is that they are discreet. No one needs to know you're doing them. This makes it incredibly easy to integrate them into your daily routine. Ensuring consistency. While watching TV, during commercial breaks, or even during your favorite show, at your desk, while working, attending meetings, or checking emails, in traffic, stuck in your car? It's a perfect time for a set of Kegels. Waiting in line, at the grocery store, the bank, or the doctor's office. Michel found the slow contractions challenging at first. He would often hold his breath or tense his jaw. His physical therapist taught him to focus on his breathing, exhaling as he contracted and inhaling as he relaxed. He started with just 3-second holds and gradually built up. For the quick flicks, he practiced them while waiting for his morning coffee to brew. This habit stacking helped him stay consistent. Common mistakes to avoid. Holding your breath. Always breathe normally. Holding your breath can strain your abdominal muscles. Tensing other muscles. Avoid tightening your stomach, buttocks, or inner thighs. This reduces the effectiveness of the exercise and can lead to other issues. Overdoing it. More isn't always better. Stick to the recommended sets and reps to avoid muscle fatigue and strain. Inconsistency. Like any exercise, results come from regular practice. Sporadic efforts yield minimal benefits. While Kegel exercises are incredibly effective, a holistic approach to recovery involves strengthening your entire body and improving overall health. These complementary exercises will support your Kegel practice and contribute significantly to your post-stroke well-being, including better circulation, which is vital for erectile function. 1. Squats, with chair support. Squats are a fantastic exercise for strengthening your lower body and core, which in turn supports your pelvic floor and improves blood circulation throughout your body, a key factor in sexual health. Starting position. Stand in front of a sturdy chair, with your feet shoulder width apart. Your toes should be pointing slightly outward. The movement. Slowly lower your body as if you were going to sit down on the chair. Keep your back straight, chest up, and core engaged. Allow your hips to go back as you descend. Depth. Go as low as feels comfortable and safe for you, ideally until your buttocks lightly touch the chair. Return. Push through your heels to stand back up to the starting position. Repetitions and sets. Aim for 10 to 15 repetitions per set, completing 2 to 3 sets. Benefits. This exercise strengthens your glutes, quadriceps, and hamstrings, while also improving balance and stability, which can be challenging after a stroke. For Michel, squats were a significant hurdle. His leg weakness made standing difficult. He started by just practicing sitting and standing from his wheelchair, then progressed to using a sturdy dining chair. He focused on slow, controlled movements, and over time, he felt his legs gaining strength and his balance improving, which gave him a huge confidence boost, knowing his body was becoming more capable. 2. Walking. Walking is perhaps the most fundamental cardiovascular exercise, offering immense benefits for stroke recovery. It improves stamina, boosts mood, and crucially, Enhances blood circulation throughout your entire body, including to the pelvic region. Starting slowly. Begin with short walks, even if it's just around your living room or a short distance down the hallway. Gradual progression. As your strength and endurance improve, gradually increase the distance and duration of your walks. Safety first. If you use a walker or cane, ensure you use it consistently for support. Wear comfortable, supportive shoes. Consider walking with a family member or friend for added safety and encouragement. Benefits. Regular walking helps maintain a healthy weight, strengthens your heart, and improves oxygen flow to your muscles and organs. Michel's first walks post-stroke were wobbly and exhausting. He used a cane and often felt frustrated, but he made a commitment to walk a little further each day. Even if it was just a few extra steps, he found that the fresh air and the feeling of movement not only improved his physical strength but also significantly lifted his spirits, reducing the anxiety that often accompanied his recovery. 3. Mindfulness and stress reduction. Stress and anxiety can significantly impact sexual health and overall well-being. Incorporating simple mindfulness practices can help manage these feelings. Deep breathing. Practice slow, deep breaths. Inhale deeply through your nose. Hold for a few seconds, and exhale slowly through your mouth. Short meditations. Even 5 to 10 minutes of guided meditation can help calm your mind and reduce stress. Benefits. Reducing stress can indirectly improve physical recovery and enhance your ability to focus on your exercises. Michel realized that his stress about his condition often made his physical symptoms feel worse. He started practicing deep breathing exercises for a few minutes each morning and evening. This simple practice helped him feel more grounded and less overwhelmed, which in turn allowed him to approach his physical exercises with a clearer, more positive mindset. As you embark on this journey, it's natural to have questions and encounter challenges. Let's address some common concerns and offer advanced tips to maximize your progress. When to expect results. Remember, consistency is truly the key. You might not see dramatic results overnight. It can take several weeks to a few months of diligent, daily practice to notice significant improvements in muscle strength, control, and ultimately, your sexual health. Don't get discouraged if progress feels slow. Every single contraction you perform is building strength and contributing to your recovery. Michel learned this lesson firsthand. For the first few weeks, he felt little change and almost gave up, but his wife reminded him of his determination in other aspects of his stroke recovery. He kept going, and around the 2-month mark, he started noticing subtle improvements in his urinary control, and then, a renewed sense of connection and intimacy with his partner. This breakthrough was not just physical, it was a profound emotional boost. Consulting a professional. While this video provides a comprehensive guide, it's always advisable to consult with your healthcare provider or a physical therapist, especially one specializing in pelvic floor rehabilitation. They can offer personalized guidance, ensure you're performing the exercises correctly, and address any underlying medical conditions. They can also help you develop a tailored exercise plan that considers your specific post-stroke challenges and recovery goals. Don't hesitate to seek expert advice. It's a sign of strength and commitment to your health. Maintaining motivation. Track your progress. Keep a simple journal or use an app to record your daily sets and reps. Seeing your progress over time can be a powerful motivator. Celebrate small wins. Acknowledge every improvement, no matter how minor. Being able to hold a contraction for an extra second, or walking a little further, are all victories. Patience and self-compassion. Recovery is a marathon, not a sprint. Be kind to yourself on days when you feel less motivated or don't perform as well. Michel's journey is a testament to perseverance. He went from feeling defeated and embarrassed to regaining a significant part of his life. His success wasn't just about the physical act of exercising, it was about reclaiming his agency, his confidence, and ultimately, his quality of life. He learned that taking control of his body was a powerful step towards regaining his overall sense of self. In summary, gentlemen, reclaiming your confidence and vitality after a stroke is absolutely within reach. We've explored the profound importance of Kegel exercises for men, not just for urinary control but critically for enhancing erectile function and ejaculatory control. We walked through the precise steps to identify these vital muscles, guided you through basic and advanced Kegel techniques, and showed you how to seamlessly weave them into your daily life. Remember the story of Michel, who, through perseverance and dedication, transformed his own recovery. We also emphasized the value of complementary exercises like squats and walking to boost overall circulation and strength, along with mindfulness for mental well-being. The key takeaways are consistency, patience, and the courage to take proactive steps for your health. Your journey to recovery and renewed confidence starts today. Don't let these challenges define you. Take control, one Kegel at a time. If you found this video helpful, please give it a thumbs up. Share your experiences or questions in the comments below. Your insights could help someone else. And don't forget to subscribe to Golden Wellness Guide for more valuable health and wellness content. In our next video, we'll be focusing on a similar topic, but specifically tailored for the ladies. So stay tuned. Thank you for watching. And remember, you are stronger than you think. Keep moving forward.